Well, John, travel instructions may change, but the federal government has made one thing clear. If you don't need to travel to Mexico, don't.
As for people coming into the United States,
we have 19 airports that have quarantine available that would cover about 85% of air travelers.
For now, quarantine units are not activated. Customs officials are using only passive surveillance. That's simply watching for symptoms and questioning suspect passengers. The consensus, there's just no way to shut down the borders.
There are times when people come in who have been infected, but they're not yet symptomatic. So the ability to actually close the borders or to affect the spread of the flu in that way is really very limited.
Getting out of Mexico can't really be restricted either.
Any symptoms of the swine flu, and if you checked off, yes, I had them, you weren't able to go into the plane, but I didn't see anyone not allowed to go on the plane.
But elsewhere, Russia, Hong Kong, and Taiwan are imposing quarantines, and Japan is using heat sensors to detect flu-like temperatures. Their reliability is questionable, though.
An infrared camera could measure a body temperature as low as 95 degrees to over 102 degrees Fahrenheit. And as far as the imager is concerned, that's all the same temperature.
Now, travelers to the U.S. are also getting these health alerts. They provide tips, for example, on proper hygiene. Julie?
CBS's Thalia Assuras. Thanks, Thalia. Joining us from Washington is Secretary of Homeland Security, Janet Napolitano. Good morning, Madam Secretary.
Good morning.
What is the U.S. government doing to safeguard the public from this swine flu?
Well, there are a number of things that are happening, from issuing travel alerts to asking the public to be conscious of their own selves if they are sick, see a public health official, sick meaning have a fever, heavy cough, that sort of thing, particularly if you believe you've been exposed. And then don't contaminate others, don't go to school, don't go to work, and the like. And of course, we are encouraging people to eliminate all non-essential travel to Mexico.
Do you think we as a nation are as prepared as we should be at this point?
Yes, we are much more prepared than we would have been, say, 10 years ago. And there actually had been a lot of preparation for a pandemic out of the expectation that we would see avian flu. Now, of course, now we're seeing swine flu, but many of those same preparations, of course, are directly applicable. And again, it happens at all different levels. It happens at the local level, at the state level, at the federal level. We're coordinating amongst many, many departments to make sure that should this erupt into a full-fledged pandemic, we're as prepared as we can be.
Do you think it's going to get to that point? I mean, how bad do you think it's going to get?
No one knows, and we follow the advice of public health professionals in this area. They're the ones that inform us, for example, that closing the border wouldn't actually help us keep out disease at this level. So they're the ones that tell us to issue a travel advisory or inform us of that fact. They're the ones that share with us how many states have the disease and where it is spreading. So we rely on them, and then we take that and gauge our operations accordingly.
In the final seconds, right now, there are no quarantines at our airports or borders, although we are capable of doing that. What would it take to activate those quarantines?
Well, I think it would take, first of all, public health officials concluding that would have an impact on the spread of disease, and then secondly, being able to detect those who are coming into the country that should be quarantined. But right now, if someone is coming in and they are suspected of having the swine flu, they are moved to or can be moved to a secondary inspection and put in an isolated room.
Secretary Napolitano, thank you.